Very good evening to everybody, and welcome to another episode of The Different News. Today, as you can already see, I have my gorgeous guest in the studio of The Different News. Welcome, Dr. Sneha. I'm very happy to have you. And I think today's episode will be mind blowing because we are talking something which is not really spoken much about and not known to people. Yeah.
Thank you so much, Dr. Gargi, for inviting me. It's a pleasure to be here.
Well, for my audience, I think we will have a lot of things to learn from Dr. Sneha, but what exactly are we talking about? Well, one curious thought I want to throw: Death Cafe. Have you heard about it? Well, nothing to do with death as such, but I think it's more beyond it and understanding and helping people, real people who are facing probably death each second. Well, I'm talking about palliative care for cancer patients and a very new initiative and fantastic concept named as Death Cafe, which Dr. Sneha started. Well, Dr. Sneha, it's stage is all yours. And first, my favorite question to all my guests is, and the same one I would like to ask you is, please tell about your journey and the fantastic initiatives that you have started, which I just spoke about. It will be very nice to know from you.
Thank you so much. My name is Dr. Sneha. I'm a palliative physician. That means I work with people who have life threatening and life limiting illnesses. I take care of their pain and the other symptoms. So, this is a good time to introduce what palliative care is. Curative care is when the intention is to cure the person of the disease, but many times we either reach a blockage or we reach a disease where curing is not possible. But we as physicians never give up in the sense we still take care of our patients. So here the focus is palliation, symptom management, pain management, and improving the quality of life. So I work with cancer patients. I've been doing that for 10 years now, clinical work in palliative care. But over time, I also understood that there is a lot of advocacy needed. Not many people in India know about palliative care, or they have a lot of misconceptions about palliative care. So I do a lot of education and advocacy work in palliative care, and also have started a few modules so that doctors, general physicians can learn about palliative care and incorporate it. So, if I have to define what palliative care is, uh, it is active total care of the patient and the family by an interdisciplinary team. So, here there are few words. One, it is active and total care. We take care of physical pain, emotional pain, social pain, and spiritual pain. Each of them we can go in detail over time. But the idea being that when a person has life limiting illness, not only that person, but their family also is affected, and affected in more than physical way. So we as palliative care physicians work with a team of people like a psychologist, physiotherapist, social worker, and make sure that all aspects of the person is taken care of. So overall, this is what palliative care is, and I have been doing this for 10 years now. And I also got trained as a therapist, a clinical psychologist specializing in art based therapy and somatic psychotherapy. One, because I have deep interest in mental health, but second, also because over time I understood that the toll the disease takes, both for the family and the person. So I thought it will be very good to get equipped even in the mental health front. So yeah, this is what I'll say about palliative care.
I think that's amazing, and I think you have explained a very complex concept in a very simple way. So, but one curiosity I just is running
Yeah.
through my mind as you were speaking, like, is there any specific reason that you chose palliative care as a specialty, or it was like you were kind of very much aware about it from when you completed your medicine and stuff? Yeah.
Yeah, this is a very interesting question you posed because I feel palliative care didn't. I didn't choose palliative care. It chose me. After my MBBS, I had gone for a vacation. In the sense, like I used to go to meditation classes. So I just went to the monastery where my teacher came from, and I thought, okay, 7 days I'll just decompress because internship is really hectic. So I was there, and I think sixth day, or just one day before that, is when the abbot of the monastery, the head of the monastery, called me because he would be seeing one Indian girl walking alone in the whole campus. So he called me. He sent a monk to call me, and he asked me like, "Who are you? What are you doing here?" And that's when I told that my name is Sneha. I just finished internship in medicine, and I came here just to decompress. And that's when he said, "See, we have a hospital here. We don't have a doctor. Why don't you come in?" So my first job was as a doctor in a monastery, which I think really shaped my course of my life and my practice. You know,
Amazing.
yeah. And I think my 2 years there prepared me to take up, or brought me to palliative care, because impermanence is such a strong aspect of Buddhism, and even the way they understood medicine, because I would come with an allopathic, completely, defense kind of approach to medicine. But many people who I saw before joining palliative care, just as a general practitioner, they would say, no, I think death is near and I'm okay. That kind of acceptance of passing on, that influenced. And finally, I think they have a very strong aspect of consciousness, like what state of mind I am in at end of one life is what I will carry to the next life. So I think somewhere even that influenced me, and that made me think that palliative care is a field that will actually make a lot of difference, not only in making the person comfortable here and now, but also probably, see, I don't know about next life and further life, and not everyone has to agree, but here and now we are bringing comfort, and maybe even later. So all these gave me a strong motivation to join palliative care. I feel, my first interest was psychiatry. I wanted to be a psychiatrist because mind and body together. But life, they say, has better plans for you. So I now I'm pushed to take care of not only mind and body, but mind, body, and soul. So I'm really glad.
Amazing. I mean, I think it is destined, and certain things are always beyond plans. And particularly when we study and we have a line of thought, okay, I'll do next this and then that, and but I think some things are always destined, which we don't realize. And amazing, amazing. It's so inspirational, and that in that tender age, the I feel in that tender age you had that maturity to understand and also accept their offer. That is also a very big thing, because not everybody will do that. I think that's really nice.
Thank you. Thank you. It was.
Yeah, so Dr. Sneha, uh, as we know that palliative care is not such a popular kind of a branch of medicine. I mean, I haven't heard it much in my circle.
Yeah.
So I'm sure that there might be the kind of work you are doing. I mean, as I understood from the explanation you gave about palliative care, it's a very comprehensive and also challenging job. And I'm sure a lot of myths would be there around. So, could you tell us some typical myths, and would you like to break any of them today?
Yeah. Thank you for the opportunity. There are many. And back when I joined palliative care, there were many more. So first of all, I'll incorporate few examples from my life as I keep sharing them. One first one is that most times we get people who come to palliative care department, especially when I used to work in a government hospital.
Mm.
When everyone is fed up of the patient, they're coming with multiple, same thing. Then they'll say, okay, now you go to palliative care. Almost like now we can't do anything. Take them home and serve them. घर जाके सेवा करिए बोलते हैं. So that's when people are referred to palliative care or people come to palliative care. The myth here being that palliative care equals end of life care. Family does not want to come because they think that, oh, maybe we are giving up if we take them to palliative care.
Mm.
Oncologists themselves do not want to refer many a times, at least earlier it used to be like that. um, because they think that, oh, again the same thing, that if we refer to palliative care we are giving up on them. So one, here I want to say is that palliative care and curative care should go hand in hand. In fact, palliative care starts at the point of diagnosis, not when nothing can be done. We researchers have shown time and again that quality of life drastically improves, the symptoms drastically improves when palliative care is started right at the beginning. Also, the outcome of the treatment improves, because the patient is more compliant, the family is understanding everything that's going on. It's a much peaceful place, pace of things that are happening. And there are a few studies that show that even the length of life like increases, not only quality but sometimes even the prognosis is better because the symptom management is there and the compliance is there. So first myth would be that palliative care is end of life care. End of life care is much, that is also part of palliative care, but it's a bigger umbrella. So that
Right.
is the first myth, I would say. Um, what else? Second, I think around morphine, there is a big fear around morphine because
Okay.
we in palliative care use opioids for pain management, which does not
Mm.
only include morphine but also other opioids like fentanyl and other patches. So, because morphine has been, scrutinized under the Drugs Act. So there is a lot of hesitation among physicians who are
Mm.
non-palliative care physicians sometimes, that, oh, palliative care wale morphine use karenge and then the lifespan will decrease. No,
Mm.
morphine, when it's titrated and used properly, it is a big boon for people suffering from cancer when used properly. And we as palliative care physicians are trained to do that. So some
Right.
amount of um, work, and lot of physicians like Dr. Rajgopal, Dr. Suresh, they have done a lot of work in removing these myths around morphine use. So that becomes a big hindrance.
Mm.
Um, Last one, I mean, there are many, as we talk, we can come to know, but here what I want to address is the myth that um people, like, we cannot take care of people at home when they're dying.
Mm.
Now, I mean, this example I always give whenever I talk in public or holding workshops. That if you notice, I'm late 80s born, 88 born, in fact. So back then, we used to see the whole Ram Nam Satya when someone dies, there'll be four people carrying, there'll be flowers, there'll be drums. So we know that a death has happened. There was
Mm.
a public acknowledgement of that. Then
Yeah.
slowly over years, it was replaced by this black van that will come and quietly go, no noise, nothing, but it's still a black van. Now, if you see when the person is, really not doing well, uh, they are taken to the ICU. Their own loved ones take them to the ICU because probably they're scared, they don't have the tools, and people die in ICU. They
Yes.
don't die at home anymore, which is very, very few people, I think, still opt for death at home because we get so agitated. We want to make sure we give the best care, but ICU is not the best care. ICU is not a place to die. So just imagine jarring lights, sound, with multiple other people who are really ailing just close by. Your loved ones are not around. So both of them are stressed. The person who's dying is very alone, and the person is outside, loved one is alone. So I feel as a society, we are regularly removing markers of death. So I
Mm.
think one big myth through your channel I want to bust is that we can very well take care of our loved ones at home and make sure they're comfortable. Death will never be painless. It will always involve some amount of physical pain and lot of emotional pain, but that can be facilitated with good palliative care, good end of life care at home. So this idea that we don't, we are helpless is what I want to break, and that is the focus of my practice. And you know, we spoke about Death Cafe. I didn't elaborate much, but Death Cafes came into existence because of this. I really
Right.
wanted people to get comfortable and talk about it. Yeah.
Yeah, yeah. So I think what you said is bang on, because just that by listening to you, I get emotional at this point, because I had no idea what is palliative care, honestly, because when I lost my dad, uh, I I can feel from inside what you are speaking, because that was the time I got many suggestions. And when it comes to care, we think, and particularly when we see such uh, our like parents or anybody who is very near to us, and we want do one thing, that okay, I think I should give the best thing, the best care, but the best is not hospital, out of just from my emotions or feelings or whatever you put. I actually made arrangements at home during the last days of my dad. I don't know how, Dr. Sneha, but to be 2 weeks before he left us, I actually started having some kind of intuition, some feeling in my gut. I really have no words to express. But that was the moment, because what I'm talking about is, again, it is around 2017. My dad left on 2017, 3rd of March. But those moments, it is so emotionally draining, and making decisions like that, because it's always on the like, you yourself feel, okay, am I doing the right thing? I'm not taking him to the hospital, I'm not, it's always like such a guilt, plus you don't want to do that. So so these kind of moments, like, if we had a specialist like you, if we had some kind of guidance on probably a more methodical approach, because whatever I did, I could just find resources and do something. And that too, I also belong, I had a background of healthcare from medicine. That's why I had some understanding that
Yeah.
what to put, what not to put. But just think of other people who are non-medical.
Yeah.
I think what you said is very important, and I think this. I highly am supportive of that. We should speak more about uh, palliative care, its importance, and how exactly it could be implemented, and how it could help people. And because
Doc-
those moments are very, very draining, very emotionally draining, and decision making is very tough. Is very tough.
right.
And
Dr.
thank you.
Gadi,
Yeah,
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 thank you so much. Here, I wanted to just interject because I want to speak about something which might, which is really very related to what you spoke.
yeah.
I have seen as a practitioner that outside ICU there is always a chaos. Some family member is like saying, take them off the ventilator. Some family member is saying, no. Someone from US is calling and saying other thing. So I
Mm.
just want to bring to attention of your viewers about advanced medical directives. So, Advanced Medical Directives is a legally binding document now applicable in India. It was also called as living will. Just as you can make a financial will where you
Yeah.
know what is going to whom, you can
Mhm.
also make a healthcare document. You make it with your physician and your family together where you can write down your healthcare decisions. Like, for example, if there is not more than 25% improvement in my health after putting me on the ventilator, please take me off after 5 days. These kind of decisions you can discuss and make it beforehand, and this can be changed multiple times.
Oh,
Yeah, this really removes the confusion and gives time for people. Give time for loved ones to sit and spend the time with the family, person who's dying, rather than make these decisions. As you said, it's so emotionally draining. We
very
cannot
difficult.
make decisions at that time.
Yeah, yeah.
So we need to another reason to talk about death and dying beforehand, very calmly,
Hmm.
because the other person is not burdened. They get time to spend with us. Another thing you can do with advanced medical directives is to choose a healthcare attorney. You can say that, okay, I don't know what will happen later, but I trust my mother to make all the healthcare decisions for me. I trust my brother. So you
Hmm.
create one person who will make the decision, who you trust, and maybe you have discussed it with them, they know you more. So That way,
Okay.
this whole confusion is avoided. So, I really urge listeners to please go check advanced medical directives. And if you need help in how to make your advanced medical directives, I'm more than happy to help you. I'm more than happy to connect you with people who can help you in your cities. So, yeah, this is what I wanted to add.
I think this is gold what you shared. Thank you so much for doing this on my show.
Thank you. Thank you.
One favorite question that is popping in my mind. I would say favorite because honestly, I recently attended one of your live workshops, and that feeling, that experience, I think I would like to talk about it. Me talking about it would be later, but today, since you are here, I would really like you to tell us more about Death Cafe and this concept, and how exactly it triggered your mind and how you made such a structured program, because I attended your workshop. So it just blew my mind, honestly. It's just an honest confession. I'm not trying to be sweet here. Yeah.
Thank you. Thank you so much. It means a lot when someone is moved after attending Death Cafe. So, Death Cafe is a concept started by John Underwood. They're a UK based person, and he and his mother started it. And they made it into a social franchise that anywhere, anyone across the world can host this Death Cafe. Um, Now, let's begin by defining what Death Cafe is. Death Cafe is a space where usually strangers come together and have a space, open space to talk about death, dying, grieving, loss. The taboo subject of death is brought there, and we can talk about our fears and anything. Probably we have ailing parents, so the topic that is not welcome anywhere else is welcome at Death Cafe. And I, yes, like you rightly said, I brought the concept to India in 2016 when I was at MNJ Institute of Oncology in Hyderabad. I saw a lot of resistance around physicians and family when it came to talk about death and dying. But the patients themselves, because that time I was doing a research on what constitutes a good death. And
Okay.
the patients who were actually dying were more than happy, in fact, very grateful to talk about it because they found someone who was not, shying away before, behind reports and tests. So, really head on facing and talking. And they really needed someone to explore their emotions with.
Hmm.
But the resistance was from family and the physicians, and that's when I thought, okay, this is a sociological issue. So I started looking up that okay, what are other people doing? How are they talking about death and dying? And that's when I came across the concept of death cafes. And without any hesitation, I started that in India. And from 2016 to now, I think more than about 93 death cafes have happened, and not even one is without show. Like, not even one, there has been a no show. That means there is so much need. People are always wanting to talk about either grief, pain, death, or, fear around it. And especially after COVID, things became very real. Earlier I can see the difference. Earlier, death cafes used to be more philosophical and, a contemplative exercise. But after COVID, people really met in a way, met death up close. Everyone we knew lost someone or during the second wave. So it became more deeper after COVID.
Right.
And now I host them in person at Delhi every month. So people who are in Delhi can come. It happens at India Habitat Center every month. And I also host an online death cafe for people outside. So you're
Okay.
more than happy to please come. Now I've started incorporating a lot of art making in the death cafe so that it's not only verbal. That we introduce different forms of art so that people who can't express, who don't want to verbally express, they also have a chance to make sense of the experience.
I think this is amazing. You're really doing a great work, and like I attended your recent workshop in Bangalore. So I think that day I went in a different mindset, because I feel that this is such a need, and that's the real truth of life. We won't exist after some time, but we need to talk about it. Most of the time, we shy away, and there's a little bit of more of emotional upheavaling most of the times when we try to be, even if we are open to talk about it, but not everybody is ready to talk about it. But it is such an important thing, and I actually love the format, because the way you made everybody bring in your trust circle, first thing, and secondly, it was more like coming spontaneously from us. It was seeming like you were just holding a mic and giving some kind of instruction. I at least feel that like we came here to do something. I mean, she's only an instructor. She's just telling us to do something. It was very spontaneous from it was coming from within, and I could feel
Yeah.
that vibe in the entire room. I mean, kudos to you. Kudos.
Thank you. Thank you so much. Yeah.
Yeah. So, Dr. Sneha, before going into, I mean, I'm also very curious to know about that art therapy thing. But one thing which is hitting my mind, because the workshop I attended, it was like we were all like adults and elder
Yeah.
adults. You know? So, when it comes to dying or death, and particularly, of course, in the space of cancer, so there are also children, unfortunately, who are also
Mm.
affected. Uh, so do you do death cafes for children, or rather, if I put it in a little other way, do you think death cafe concept would also be helpful for children? And is it not very more difficult to talk about death to children? I mean,
Mm.
uh,
Mm.
something in my mind. Yeah.
Yeah, yeah. In fact, first of all, lot of what I'm doing, like you rightly said previously, is
Hmm.
that I'm holding space and facilitating conversation. If you
Yeah.
say more, there is listening that's happening in Death Cafe and people are talking. And I very firmly believe that children also have a right to talk about death and dying and the emotions they feel around death and dying. Um, because somewhere when we see that it's difficult or it's dangerous, we assume, we kind of disrespect the intelligence of the children. Yes, of course, it has to be done in an age appropriate way. But if we think back, Dr. Roy, even as kids, we used to play these games
Yeah.
where I'll die and then, someone else does, and the shooting game. So we cannot negate, we cannot negate the fact that children think and talk about death and play games around it. And especially in cases where children themselves are suffering. In MNJ we had a children's ward also, which I used to sometimes handle. So they are physically feeling the pain. They have been receiving the treatments for months, if not years. So hiding what's happening to them from them is is a big disservice, I would say, because that child wants to understand what's happening, and we as adults, I think it's a responsibility to explain to them in a way that they can understand what's happening. And also in that conversation, a lot of communication about the child's feeling will come. It's not, I feel it is not fair to leave
Hmm.
the child with these big feelings
Right.
because we as adults are uncomfortable. So I feel death cafes in children, or we call it death cafes, but having these conversations about death and dying in children, around children, is more important. So one is this population where the children themselves are suffering,
Hmm.
but even adults,
Hmm.
when they are suffering, they have children. It's a
Yes.
big hole and a mark in the child's psyche or child's life when nobody is talking about what happened to papa, what happened to mama. you know
Absolutely.
so children of people who are ill,
Hmm.
and also siblings, that is a very missed aspect. When a sibling passes on, the other sibling has this major guilt of living, and then it is that child is left with the grieving parents. The parents
Yes.
are never as they are before, and the child has to live on with grieving parents, so it is very difficult. So I
Very.
think it is high time that adults equip ourselves. First of all, we are able to face and talk about death and dying, and we equip ourselves to do that with children. I've
Mm.
done this about 3, 4 times. Once in Hyderabad itself, there was an alternative educational space called Vision Rainbows, where they took consent from the parents
Okay.
and brought the children to death cafes. And the stories, the sharings that came over there was really heart touching. You know, children spoke about how they experienced the death of their pets. That's a big thing for them, and also experience the death of their grandparents, because again, grandparents are such an important figure in a child's life, and the
So,
child does not want to talk about it with the parents because the parents will feel sad.
mm,
So it's just left with that big feeling. So a lot of these conversations do come up, and I think it's really important and very can be done. Little bit of patience and skill can be done. Yeah.
yeah, yeah. So, coming back to another very interesting aspect of your work, that is, you mentioned a little while ago about art therapy. So, can you tell us more about it, like how you are implementing, or because you have also studied clinical psychology, if I'm not wrong.
Yes. Yes.
So,
Yeah.
how do you exactly curate the thing? I mean, we're really interested to know how exactly things this work actually. Yeah.
Yeah. So I went back to college, full time college, and studied clinical psychology with 21-year-old friends. And but before that, in 2017 is when I studied somatic psychotherapy, and then in
Okay.
2020 I studied art therapy. My practice in right now in terms of psychology is based on these two. It is beyond the cognitive, so we are coming back to the body, we are coming back to the emotion,
Hmm.
and I've understood art therapy to be more democratic process.
Right.
Not everybody has the words to explain what's happening inside them clearly, or not everybody has experience. All their lives they have been quiet and hiding their feelings. Suddenly you put them in front of therapist and say speak. Not possible for everyone. So I feel art therapy levels the ground. It gives tools for everybody to express, and especially for people who are actively dying. Um, there are many experiences that cannot be captured through words that I will never understand, even if they say. So art therapy becomes a big medium. People who have undergone trauma, for them, art therapy becomes a very powerful medium. For caregivers themselves,
Right.
get tired of explaining their feelings. So art therapy becomes a very strong medium. And one I would like to say that in art therapy, we are not negating words. We still do a lot of verbal processing, but we also take help of other modalities. We use visual arts, photographs, films, collage making, sculpture, depending on the what person is comfortable with. I had one client who could just not speak after they had their surgery. They had a mastectomy, they lost their breasts, and it was a big challenge in their marriage and intimacy, and they just stopped speaking because they felt that they just lost their essence. And we did a lot of voice exercises. We did body maps with them. So art therapy has a lot of tools that can be very well incorporated into any healthcare, but especially in palliative care.
Hmm.
So this is a little bit. I hope I've been able to answer your question.
Very nice. I mean, it is very interesting. I think we need another session on art therapy itself. So, I mean, this small time is little, very less
Right.
to understand the depth and width, the kind of work you are doing. I mean, really, really, so
Thank you
nice,
so
so
much.
nice. And I remember one word which you like in your workshop. Maybe I'm just gathering little memories from there. Uh, if I'm wrong, please correct me. Like something called as abortion healing circles. I think I
Right.
gathered that word, and I was not very clear on the concept. So, would you like to talk about it, and who could? I mean, actually, who are the people who are applicable for this? Or I mean, as a whole, if you can
Yeah.
just explain that, yeah.
Yeah. Thank you so much. Um, Abortion healing circles are group work, group therapy work, where people who have undergone either miscarriage or for any reason they've had to choose a medically termination of pregnancy or they've had stillbirth, you know, 9 months they bore the child and then a still baby came out, or after birth also within a few
Yeah,
days they pass. That is a big grief, and that is a very left out grief. Like cancer grief is visible, people dying from death and disease, sorry, from disease is very visible, and you have support for that. But when this kind of grief happens, especially you're going to the door of birth with all the hope, expectation, this is a bigger shock, and there is absolute stillness and silence around it. Even if you look around, so many
true.
of the listeners themselves, they or their wives must have
Yeah,
lost a child, but um, we are not speaking about them. Generally, we hear, oh, you abhi to tum jawan ho, try once again. It's very difficult to even come to the act of making love after you've lost a child. It's very huge. So I feel, I mean, this came as a woman, because whenever I used to host sessions, I mean, I come from a feminist framework of this thing. So a lot of people, I mean, I take care of the gender aspect of it that mainstream medicine sometimes forgets. It's not only a patient; it's also a woman who's suffering. And in many of uh, in many times I came to know that this is a big grief, so I started hosting group therapy sessions for people who have lost children, I would say, or who have had to choose not to have a child. My time is not right, the circumstances are not right, and willfully not choosing to be a mother, that's a huge toll that it takes. So I started hosting them. Then over time it became that not only women themselves, but their partners are
yeah,
grieving. That intimacy is gone, and men especially don't have space at all to talk about this. Like, really, who will they talk to? At least women talk to, even if they do with their friends, with their sisters. Men don't talk about it. So I started hosting for couples also. Where they're able to explore each other a little more deeply and able to support each other in their grief. If you've seen the movie Talash, you
yeah,
know
yeah, yeah.
this big divide is so well shown. So somewhere we move away from each other when this
Yeah.
thing happens. So bringing them together to say both of us lost, and both of us need each other. So that kind of intimacy work, grief work, death work. Is what happens at abortion healing circles, and we use a lot of grief concept from grief therapy, but we also use a lot of art-based exercises, and many times the community itself is healing.
Mm.
Hearing experiences of other people, that gives support. It shows that it's not an isolated event, it didn't happen to me and I'm not wrong somewhere or punished. So that is a big experience, and I love hosting these group work sessions because it moves me very, very deeply. Yeah.
So I think, as I said, that we need more sessions with you, talking about, the kind of things that you are doing. And I mean, one last question I would definitely want to ask you, because you are dealing with real problem of people. Meaning to say, when it comes to grief, pain, trauma, death, um, most of us think that it is very, very personal, and we try to always keep that smiling face, that glittery outlook, but inside every day we are breaking any kind of
Mm.
trauma as well, right?
Yeah.
So how do you keep yourself so positive? Because I met you in person, you are such a lovable and positive person. So how
Mm.
do you keep yourself so positive? I think, yeah, I'd really like to know that.
Thank you. That's a compliment. I mean, I want to tell something that when I started my clinical work in palliative care, which happened in Hyderabad, MJ Institute of Oncology, I started somewhere also hoping that my spiritual practice in Buddhism will be strengthened because I'll keep seeing death and dying. So
Ah,
I will lose the attachment to life. I will have these big, what do you say, epiphanies. That was my mind when I joined. But I think after 1 year into, or 6 months, 6 months into clinical work of palliative care, I traveled for 3 years straight. I packed my bags, put my things in my friend's house, and traveled across the country, of course, training people in palliative care and giving workshops. But I needed to do that. And working with death so close helped me to value my life, helped me to really see what is important to me. And, time became more precious. I mean, the reason I'm telling you this is that I don't know if I really am spiritually strengthened by doing this work, but yes, working closely and keeping the idea of mortality and meaning in my mind constantly helps me always think that, okay, what is it that I want to do and in the precious time? And many times I do, which are not, you know, socially accepted as a doctor. Which doctor travels for 3 years across the country, Andaman, Jharkhand, um,
Right.
you know, training people for free in palliative care. So I did that. So I
Mm.
feel my work frees me. I joined dance classes. I learned
Wow.
how it's a traditional dance form. So, and
I
also
know,
art making. Sorry?
I know about show. Is that's
So, yeah.
it's a very vigorous dance form. Yeah.
Yeah. So I learned that, and I think my spiritual practice and my art practice, if I have to put it short,
Yeah.
these two really helped me. And one is like which I told, the overarching umbrella is time is precious. Then you don't think about what people will think. You do what you have to do. So that also I feel keeps me very alive. I'm
Yeah.
not bothered so much as other people are. So thank you, thank you for asking this. Yeah.
Thank you, Dr. Sana. It was wonderful talking to you, and just that because we talked at least for I think for my audience here, there are even for me certain new concepts I have learned today as well from this conversation. So, for example, if somebody wants to take your therapy or your attend your workshops or any other guided practice management things that you are doing to train the fellow what to say the healthcare professionals themselves, so how could they contact you, and where can they reach out if you would like to share that?
Yeah, yeah. Thank you so much. Dr. Sneha Rooh on Instagram. You can find me there.
Okay.
Again, that account is always available. It's a public account.
Hmm.
And again, Dr. Sneha Rooh at gmail.com. You can email me. My website is in the process of being built, but these two places I'm more than happy. And I would really wish for people to join the online death cafes. There is an upcoming abortion healing circle that's happening in December. So if you know someone who can benefit from it, please share the news with them. So these are the things that are happening. Thank you so much.
Amazing.
And really, Dr. Gargi, I appreciate this opportunity to speak and reach out to more people. Thank you.
Absolutely. I mean, this is my pleasure, and I think I think you are not only contributing to science because I am somebody who is always passionate about some real work going on in the world in the field of science, healthcare, because I'm very passionate about it. To talk about it, bring such fantastic people, and thank you. I think we met for a very brief time, but I think we connected like we never felt we are meeting for the first time. I mean, at least I had that feeling, you
Same,
know.
same experience. I think one breakfast together, but I was swept. Yeah, yeah.
Yeah, I think that, and thank you for your time today. And I think we'll keep talking about it. And I would definitely love to host you again in some other time in the near future with some more interesting work. Particularly, I'm very interested about that art therapy, what exactly you do, how you do. Maybe we'll talk about it later sometime in another episode. Thank you. Thank you so much for being here. It's a pleasure to host you. Thank you.
Thank you, Dr. Roy.